ZOLGENSMA, onasemnogene abeparvovec-xioi, is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into the vein. ZOLGENSMA was not evaluated in patients with advanced SMA. ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Please continue watching for additional important safety information.
Lucy.
Our doctor spoke with us about treatment options that were currently available, and ZOLGENSMA was recently FDA approved, and our family chose it because it was a one-time infusion as opposed to something that she might have to be doing for the rest of her life.
When we chose ZOLGENSMA, we decided we wanted to use it because it was a one-time gene therapy treatment and it treated the root cause.
Patients will receive an oral corticosteroid and will need blood tests before and after infusion with ZOLGENSMA.
You have a yellow one?
We chose ZOLGENSMA to allow her to produce SMN protein with a one-time treatment.
All the way to the end. Good girl.
Almost immediately after Natalie was diagnosed with SMA, we spoke with our doctor about ZOLGENSMA. He was so passionate about it and so excited and had positive feedback about ZOLGENSMA. Our doctor did explain to us that there were potential side effects, but we felt that the benefits outweighed those side effects. It seemed like the best option for her.
We wanted Lucy to receive treatment with ZOLGENSMA after actually doing a lot of research. We were going on different websites, even going to, social media, looking at some of the family groups that were out there. Any support resource that we could find. And after a lot of that research, we sat down and said gene therapy is where we need to go.
As we spoke with other parents whose children had been treated with ZOLGENSMA, we felt like that was the best option for Quinn. We asked Quinn's doctor for ZOLGENSMA because we felt it would stop the progression of her SMA and that she would become stronger over time with this treatment.
Ask your child's doctor about the one-time infusion with ZOLGENSMA. Please continue watching for indication and important safety information. Indication. What is ZOLGENSMA? ZOLGENSMA is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into a vein. ZOLGENSMA was not evaluated in patients with advanced SMA. Important safety information. What is the most important information I should know about ZOLGENSMA? ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Patients will receive an oral corticosteroid before and after infusion with ZOLGENSMA and will undergo regular blood tests to monitor liver function. Contact the patient's doctor immediately if the patient's skin and/or whites of the eyes appear yellowish, if the patient misses a dose of corticosteroid or vomits it up, or if the patient experiences a decrease in alertness. What should I watch for before, during, and after infusion with ZOLGENSMA? Infections before or after ZOLGENSMA infusion can lead to more serious complications. Caregivers and close contacts with the patient should follow infection prevention procedures. Contact the patient's doctor immediately if the patient experiences any signs of a possible infection, such as coughing, wheezing, sneezing, runny nose, sore throat, or fever. Decreased platelet counts could occur following infusion with ZOLGENSMA. Seek immediate medical attention if the patient experiences unexpected bleeding or bruising. Thrombotic microangiopathy, TMA, has been reported to generally occur within the first 2 weeks after Zolgensma infusion. Seek immediate medical attention if the patient experiences any signs or symptoms of TMA, such as unexpected bruising or bleeding, seizures, or decreased urine output. There's a theoretical risk of tumor development with gene therapies such as Zolgensma. Contact the patient's doctor and Novartis Gene Therapies, Inc. at 1-833-828-3947 if a tumor develops. Infusion-related reactions may occur during and after Zolgensma infusion. Seek immediate medical evaluation if signs and symptoms of infusion-related reaction occur, which may include rash, hives, vomiting, shortness of breath, respiratory symptoms, and/or changes in heart rate and blood pressure. What do I need to know about vaccinations and Zolgensma? Talk with the patient's doctor to decide if adjustments to the vaccination schedule are needed to accommodate treatment with a corticosteroid. Protection against influenza and respiratory syncytial virus, RSV, is recommended, and vaccination status should be up to date prior to Zolgensma administration. Please consult the patient's doctor. Do I need to take precautions with the patient's bodily waste? Temporarily, small amounts of Zolgensma may be found in the patient's stool. Use good hand hygiene when coming into direct contact with patient body waste for 1 month after infusion with Zolgensma. Disposable diapers should be sealed in disposable trash bags and thrown out with regular trash. What are the possible or likely side effects of Zolgensma? The most common side effects that occurred in patients treated with Zolgensma were elevated liver enzymes and vomiting. The safety information provided here is not comprehensive. Talk to the patient's doctor about any side effects that bother the patient or that don't go away. You are encouraged to report suspected side effects by contacting the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch or Novartis Gene Therapies, Inc. at 1-833-828-3947. Please see the full prescribing information.